Baystate Health is one of the largest integrated delivery networks in Western Massachusetts. 5 hospital health system, 80+ medical groups. We serve roughly 850,000 patients. We have about 12,000 employees now. With the paradigm shifts that we're seeing in the way that healthcare is really forcing organizations like Baystate and others to function, we also have to change with those times.
As we move to an ambulatory setting within healthcare, our docs are moving around. A big portion of that is, do we want them carrying big laptops, or do we want them to be able to go and tap a badge and have their session pop up? So as we've been able to deploy that and look to putting virtualization in place, we're seeing a much greater adoption and excitement, quite honestly, among our clinical staff and other users at being able to work whenever they want to, from wherever they want to.
So VMware is providing us with a lot of great options to enable us to have secure network, secure endpoints. It also provides us with the ability to really re-envision and redesign our infrastructure. And VMware has really provided us with a lot of those capabilities.
Baystate Health has a number of sister-related organizations that deal with data and security models that are somewhat different from the hospital itself. NSX allows for the underlying architecture to separate out, define, report, and control. Now, if a product supports NSX, inherently it has insight into the deepest parts of our network. So the amount of configuration is more straightforward, and the reports are more meaningful.
As the organization grows and we increase capacity at one data center versus another, VMs can just shuffle around as needed to maintain balance, and we can't do that without vSAN.
The fact that I don't have to worry about data being resident on a disk that is somewhere other than my data center, potentially somebody's laptop or mobile device, or something that might, quite honestly, an office gets broken into and stolen. HIPAA compliance and all the rest is terrifying for health systems, so being able to have everything centrally managed is huge.
The reality is 95% of what we're doing at Baystate Health is applicable to every institution of its scale.
So why VMware? Well, part of what we're looking for are partners who can scale in the future and who can really bring us to the next level.
We found a model that really is the model for healthcare in general.
And with VMware and their parent EMC, we've found great partners and really a great vision and a roadmap.